So I believe that I'm going to use this occasion to introduce myself, because many of you don't know me or know me very little. I was born in Montreal. I moved to Quebec City when I was 6 years old, so my studies were done in Quebec City. I graduated in 1965 from the Faculty of Medicine at Laval University. I practiced general medicine in a private clinic for 25 years, and the last 7 years of my practice brought me to the use of RHUMART machine, after meeting Dr. Drolet through my brother, who used to work at the Schule Hospital, where Dr. Drolet was responsible for the electronic machines at the hospital. So in order to sum up the use that I did of this machine, I had the first generator was set up by Dr. Drolet, the M by HB1000 machine at that time. I only had Rebond and Mini Quattro, and I didn't have the means to buy a Maxi. If you think it's expensive today, it was much more expensive 10 years ago. So I used these applications for limited cases of muscular problems and skeleton problems, and I had the same result as you've heard tonight: back pain, bursitis, and from one time to another I could see that there is a very positive effect, and sometimes very rapid. So I used this machine more and more with my patients. I proposed conventional treatments to my patients, and I also proposed the RHUMART machine. And when they accepted the RHUMART, I asked them not to use any medication, so that I noticed that it was really the positive effect of the RHUMART that really improved the situation. So I don't want to be too long about my personal experience. In the first 3 publications of the RHUMART magazine, you will see the study that I made and that I presented in a meeting of family doctors in Quebec, and all the results will be published in this magazine. I also wrote an article on rheumatoid arthritis, the conventional treatment. I invite the people to read the secondary effect of the medication that we prescribe for rheumatoid arthritis, knowing quite well that it doesn't cure this disease, while RHUMART stops this disease. I also want to thank people who bore witnesses. They were extraordinary testimonies, very precise, and this is the kind of testimony that we like, especially that I like. And presently I'm getting on paper a medical questionnaire that will be sent to all owners of this self-health RHUMART system. And if they want to answer the questionnaire, I will ask them to answer the questions. If they fill the form by giving the main diagnosis, the former treatment that they had, the medication that they took, and the RHUMART treatments that they gave themselves, with the parameters which could help to help other people. And also, I would like to establish a certain amount of statistics. When people come, we always have a case of multiple sclerosis, but we have more than one case. If we have 50 cases and we publish positive results, it will be very interesting, and it will push the doctors in the back, especially those who don't believe in it. And very often the family doctor is more open because he is more human and he sees human suffering. And even if you have great specialists in major clinics, they don't have much time to deal with these things. There will be a follow-up questionnaire after this form is filled, and we will see the evolution of the use of the machine and the evolution of the disease. And after completing the first report, you will see the long-term results. And these reports could be completed according to your own judgment, according to the evolution of the disease that you are suffering from. And on a long-term basis, it will be interesting to see after 2, 5, 10 years of using this RHUMART machine on a regular basis. You will see that those who are owners of this machine and those who use it regularly will see if in fact they will be less sick than the population in general. This will be very interesting statistics. So I encourage all those who have a RHUMART machine to use it on a regular basis, even if the problem is solved, but they could have something else, like they could have arteriosclerosis, they could have heart attack. But if using the RHUMART machine improves and cures a certain given problem, it could be a tool of prevention also, and we'll see with these statistics. Thank you.